Diabetes and bone disease. Today's talk will be on diabetes and bone disease. It's a very wide topic for discussion if I go by each and every bone problems noticed in diabetic patients in detail. Hence, I shall only touch upon the important ones and very briefly for our patients to have a general idea about what they should know about it. Apart from complications that can occur to eyes, nerves, kidneys, and heart, diabetic patients are also at high risk of bone diseases and fractures, especially of the hip. How does diabetes affect bones? Uncontrolled diabetes can lead to breakdown of musculoskeletal system, which includes bones, joints, ligaments, and tendons. In type 1 diabetes, they usually have a lower bone quality. Type 1 affects young people when their bone mass is still growing. Peak bone mass is the maximum strength and density that bones can reach. Low peak bone mass increases the risk of osteoporosis as you age. People with type 2 diabetes have higher bone density due to increased body weight. So they are often not diagnosed with low bone density or osteoporosis. There is evidence suggesting that the strength of the bone in people with type 2 diabetes is 10% less than in those without diabetes. Long-term exposure to a diabetic environment leads to change in bone metabolism and impaired bone microarchitecture through a variety of mechanisms on molecular and structural levels. These changes predispose bones to an increased fracture risk and impaired osseous healing. Now, what are the commonest bone diseases associated with diabetes? Commonest bone diseases include osteoporosis, osteopenia, Charcot foot, diabetic hand syndrome, diffuse idiopathic skeletal hyperostosis, frozen shoulder, and Dupuytren's contractures. What are the commonest symptoms in diabetes-related musculoskeletal problems? Symptoms include joint pain, swelling, stiffness, muscle pain, reduced ability to move joints, joint and bone deformity, pins and needles sensation, which is uncomfortable tingling and pricking in the arms, legs, hands, and feet. Diabetes is also linked to arthritis. Now, how can we reduce the risk of diabetic bone disease? Regular exercises makes the bone stronger. The best exercises for improving bone health are weight-bearing exercises like walking, jogging, climbing stairs, dancing, and playing tennis. Strength training exercises like lifting weights, push-ups, etc. are also very useful. Diet plays a major role in bone health. Foods containing lean meat, fish, whole grains, fruits and vegetables, nuts and seeds are very essential for bone health. Make sure you're getting plenty of vitamin D and calcium too. Avoid smoking and excess alcohol consumption. Keep your blood sugars under good control, and you can use medications to improve your bone density to prevent osteoporosis and bone fractures. Thank you.